An employee at Arlington's Whole Foods tests positive for the new coronavirus. As of April the 2nd, town leaders report 2 dead as a result of COVID-19, and that number is expected to rise. The Select Board this week decides on a tentative town election date. We talked to medical experts who say they've treated at least 2 area patients who tested positive for the coronavirus. Parents are doing their best to homeschool their children as town schools have been shuttered, but it has not been easy. All this as the town of Arlington is together, apart. This broadcast was edited on April the 3rd.
From McLennan Park to Spy Pond, from Poets Corner to the Mystic River, we have Arlington covered. We're your neighbors, a friend you can turn to. This is ACMi News.
Good evening and welcome to this edition of ACMi News. I'm Jeff Barnes. As we enter the month of April, Arlington is a virtual ghost town. Many businesses already are shut down and a lot of people are working from home. And a great majority of us are just spending time behind closed doors doing what we can to wait out this coronavirus crisis. Meantime, matters of the town continue. At its meeting on March the 30th, the Select Board unanimously approved a tentative new date for the town election after the original date for Saturday, April 4th was called off. The new target date is now set for June 6th from 8 a.m. to 8 p.m. But all that depends on the trajectory of the coronavirus. And it was at that Select Board meeting on Monday where Town Manager Adam Chapter announced Arlington's first victim to succumb to this global pandemic.
Also, very sadly, we learned of the first death of a resident of Arlington from COVID-19 today, a 68-year-old male. So not that anybody was not considering this to be real or taking this seriously, but that certainly brings it home and makes it much more real to many of us, certainly those who knew the deceased as well as his family and loved ones.
Town leaders are in touch with Arlington's Board of Health as they work very closely with the State Department of Public Health to do what they can to stem the flow of this pandemic.
On a daily basis, they're working with the state DPH, working through a state database to identify people who are positive for COVID-19 in Arlington. From there, they begin what's called the process of contact tracing, working to determine who that person who's been found positive may have been in contact with as DPH defines a contact, which in general terms is being within 6 feet of someone who's been found positive for more than a 15-minute period of time. So they work to trace as many contacts as they can identify, reach out, communicate with those contacts, and then place them in quarantine. And this is all in an effort to break the line of transmission of the virus. So these are efforts that are ongoing and will be ongoing to try our best to contain the virus spreading in Arlington. Beyond that, it's our Board of Health staff that is advising us on the measures that we should be taking as a general public and as a population here in Arlington to try to stem or break the line of transmission or stem the spread of the virus in Arlington.
I talked to Adam Chapter from his home earlier this week, and he says as the number of COVID-19 cases rises and people tend to get discouraged, now more than ever is the time for everyone to do their part to flatten that curve.
I mean, I guess the best I can say is we're all in this together. We're all going through the same thing. People are in their homes, they're balancing work responsibilities, home responsibilities, whatever other stresses they have in their life. If you can safely get outside, it is okay to get outside. It is okay to go for a walk. But really embracing that physical distancing or that social distancing is important to continue to flatten the curve. And, this is an interesting effort on all of our parts, right? Across the whole world that we are working hard. We're working hard, not doing much, but working hard to see that nothing happens. Mm-hmm. So if we're successful, it will mean things don't happen. So it's a hard concept, right, for us to think about. We're not all doing this for something to then happen for us to see. Mm-hmm. We're all doing this so something doesn't happen. And it's gonna be hard for us to be able to see success and to measure success. But there is not an expert in the world that's not saying that these efforts are critical to saving lives. So for everybody in Arlington, I would say, please keep it up. I think the vast, vast majority of Arlington residents are adhering to these guidelines. The few times that I've been out going back and forth to the office, this town, for better or worse, is a ghost town. There's no parking everywhere on the streets. People aren't out, and that tells me people are adhering to the guidance. And I want to say thank you to everybody who's listening up and doing their part.
You can see more of my interview with Adam Chapdelaine on our website, the ACMi.tv website. Just click on newscasts. It's also on ACMi News Facebook page, and you'll always find the interview on the town website. That's arlingtonma.gov. Social distancing is clearly having an effect on everyone, and now that schools are closed for business, that's putting extra pressure on those families who have students just trying to finish out this school year. How are those families holding up in Arlington during these very trying times? Here's Assistant News Director Brenda Mahoney.
The Arlington School Committee met for the first time since there's been no school due to COVID-19. Dr. Kathleen Bodie, the superintendent of Arlington Schools, laid out during a video conference what the district has been doing the past couple of weeks, reaching out to families, making sure that they have access to computers, handing out over 300 Chromebooks. But the status quo is that there will be no additional actual assignments necessarily coming from teachers. Pointing to the Department of Elementary and Secondary Education guidance that no new material necessarily be taught. They understand, though, at the high school level that might happen between teachers and via Google Classroom. All students, third grade and up, will have access to Google Classroom. The school committee members saying that parents are feeling overwhelmed. If you are a parent like me, especially one of a younger child in the second grade, you know that trying to balance work, maybe even working outside of the home, as well as teaching your kids is something that is just extraordinary to try to do at this time. And school committee members reflected on that and are looking for more structure and reaching out to parents. Dr. Bodie saying that this is simply what they're going to be doing for the next week or so, and reaching out a little bit more, teachers will be, to students or families, and that things are changing and there's still just a lot of unknowns.
What we need to do right now is to promote deeper learning and practice of concepts that have already been learned, and there's certainly much that can be done there, as well as provide enrichment exercises so that students can continue their learning and be able, at the end of this time that we are in closure, to be able to come back into a regular school setting as we've had.
I think one thing that parents have found frustrating is that they feel like they're just getting links. And I think that raises real equity issues, because some parents are able to take those links and be robust with them and come up with a curriculum on their own, and other parents aren't.
I'm not saying that this is not how we're going to evolve. At the moment, that's not what we're doing.
I don't think any district can be prepared for something like this. It's my kudos to those in the district who are working very hard to try to continue engagement between teachers and students, which is actually the most important thing, I think, at this time. But maybe just talk a little bit about the work that's being done and the thinking that's taking place on that kind of an issue. How do you make up lost work?
We do wonder whether we're going to be looking at further closures. We don't know. And I think that's the uncertainty of all of this. But meanwhile, you have to plan. And the what ifs. If this happens, what are we going to do? If that happens, what are we going to do? And that's the kind of where we are right now. I will say, though, the last 2 weeks, we've been just trying to run quickly to deal with all of the other things that we needed to do in terms of getting resources out there, getting food, getting packets out. It's just been quite a big effort. But I do think we're going to have to look at this and be planful.
My feeling has been over the last 2 weeks that, the reality of it is that you need us parents more than you've ever needed us before. We are having to implement what our teachers and our curriculum leaders and what the highest levels of our administration want to have happen. I think that we need to provide more to parents and to families, because we now are not dropping our kids off and picking them up and making sure that they brought their lunch or not. In my case, we're doing this. We're doing this work. But I also think that we need to acknowledge that in this situation, we are playing this absolutely critical role in the education of these kids.
I think what we need is a plan, a remote learning plan, just so parents can know that either maybe it's just once a week for now. For next week, it's just once a week. Maybe after that, it'll be 2 or 3 times a week. Their students can be expecting assignments from their teacher, which they're expected to turn in, will not be graded, but will be corrected. And so I think that kind of cadence and that kind of clear structure is what people are looking for, and it should be, communicated to teachers and to parents so that everybody's on the same page about what's happening.
Trying to figure out how to reach all of the kids that normally would just come into our school buildings and we have all the people, the supports. It's challenging and we start to realize really how special schools are, that people come to them, because it's really difficult to provide everything that students need in this kind of situation. And it's not going to be perfect, but it doesn't mean we're not going to keep trying and trying to think about how we can do better and how we can reach more kids.
So as you just heard Dr. Bodie say right there, that they are planning to reopen school May 4th, just as the governor is allowing, and they are planning for that and acting accordingly. They can't get too deep into the what ifs right now, and as we know, the surge has yet to come in COVID-19. So we'll wait it out. In the meantime, school committee will meet again next week. Brenda Mahoney, ACMi News.
Earlier this week, I spoke to medical experts at AFC Urgent Care in Arlington. They're located at 1398 Mass Ave. And they tell me they've already had patients come into their facility and test positive for the COVID-19 virus. Those patients are currently in quarantine. Meantime, just like a lot of other hospitals and medical facilities nationwide, urgent care is very short on the proper equipment they need, the personal protective equipment, or PPEs, like N95 masks, gowns, and also eye shields. They tell me without those proper tools, they're finding it very difficult to do their job.
We've been having several concerned folks from Arlington and neighboring communities that are concerned about their symptoms. And we have set up a triage for our COVID-19 patients through our website. So they can actually just log on and discuss, put in their symptoms, at which point my team is able to contact them via phone call to say, can you register online or through email, so that they don't have to actually come into the clinic right away if they're not feeling good. And we encourage them to do that at home, and they are sending us the paperwork back. We're having them speak to a provider who is then assessing them for their symptoms, and we are doing the COVID testing in our back parking lot. I'm not sure if you're familiar where we are located. We are in Arlington Heights.
Right.
Yes, so right around Massage Envy and what's that?
We're right across from the T station, the bus stop.
Right. Okay, good. So you're conveniently located, without a doubt, in Arlington. Now, have you had anyone come into your facility and test positive for the coronavirus?
Yes, we had two tested positive as of yesterday.
And from what I understand, as of this interview anyway, the confirmed positive cases stands at 12. Is that what you're hearing as well?
Yes.
Yes, correct.
Okay, now what happens with people who may be, a lot of people are concerned, obviously. This is a pretty tense time for everybody, but is anyone just worried they have it? They are showing absolutely no symptoms whatsoever. Are they calling you up and saying, hey, I just want to be tested? What are you hearing?
Yes, so Jeff, that is true. There are plenty of people out there who are worried about it or may have been exposed to the coronavirus through household contact or someone else. And obviously there's a concern. And asymptomatic carriers is a concern for all of us, because those are the people who don't have symptoms who can spread the virus. And that's one of the things I think that the CDC, the Center for Disease Control, is saying, that we don't need to test the asymptomatic people. But when you start looking at the successful countries like South Korea, where they have had success in controlling this and flattening the curve, as they say, has been because of widespread testing on everyone. And so you can identify that asymptomatic patient and tell them to quarantine themselves. So obviously we are behind in that. we believe that everyone should be tested. I think the biggest thing in the United States we've had is a lack of testing. And then the bigger lack right now is a lack of protective equipment for the people who work with us, our valiant and courageous workers here and doctors here who are going out and seeing patients and testing them. We obviously have done a very unique thing over here where to reduce the chance of transmission to our healthcare workers. Because for your listeners and readers, the important thing to understand is if we knock out the healthcare workers, they're gone for at least 2 weeks. So to try to keep our very limited healthcare community intact, we have initiated a telehealth system where the patient calls in, we can screen them over the phone and then decide if they need a test or not. I'm hoping with more widespread testing that we can test everyone who has a concern, because I think from a public health perspective, that would be the ideal situation, just like South Korea and China and Singapore and other countries have done. I think the Western world is a little bit behind in this, but I'm hoping with opening of supply chains, it's hard for us to get gowns and gloves. We're wearing masks right now. We're not maintaining a social distance of 6 feet for this interview, but there's only so much we can do because we're doing this as a public health message. But there are unique things we've done using telemedicine to help people. I think the other thing that's important for your listeners and readers to understand is we get a lot of phone calls saying, why is the test not free? Well, the test is free, but there are 3 other components to it which are not paid for. That is why the telehealth visit, and it's important for the people to understand what a telehealth visit is. It's like a doctor's office visit, except for it's through a video chat or a telephone chat. So the government is providing free tests, but they don't pay for the people who have to go out and do the tests on you. They don't pay for the supplies that need to go in to collect the test. And so those are the 2 important components, because without that, having a test sitting in the corner is useless. You still need people to collect it. We need people to put it in a vial and then send it to the labs. And then the labs themselves are getting paid by the government for the actual testing they run. So that is the 2 components which I think people are getting upset at us as well, that why do we have to do a telehealth visit? Because number one, we're trying to follow the CDC requirements that we've got to screen people, and all my providers do that. But at the same time, the healthcare providers are taking a lot of risk to come out, whether it's in your car or bringing you into our center. We have to pay for the personal protective equipment. We got to preserve this small healthcare community out there so that we can continue to function as the numbers go up. Also, just to backtrack for your article, I would confirm the number of positive cases in Massachusetts, because I think it's up to 200 now, not 12. So you might want to confirm the last number because it's updated this morning.
Right, that 12 was just in the Arlington community. How much does the test cost? I'm just curious.
So we at this point have no idea what the cost would be to us. We have been out in the front line since this whole outbreak. We are providing the testing without knowing whether we're going to get paid for any of this.
Wow.
We just want to be out there for the community, because without knowing that you have it, you are not going to be able to protect people around you. So to date, we have no idea what these local labs are going to charge us. The only thing that we have made it public in our website is that we are going to, if someone has no insurance, we will charge $199, and in the event their insurance covers it or anything such as that, we will refund. We have no idea. We are just going out there blindly and helping the people right now.
So everything right now is up in the air.
Yeah. So for you to understand as well, AFC Arlington and Watertown, we're a small business. So, we will keep on going and serving the public as long as we can, because, ultimately it is a financial business. And at some point, if we don't get paid, then we'll have to look at other contingencies. But right now, we're doing whatever we can out of our own personal savings to help the community in Arlington, Watertown, and surrounding communities. We'll do what we can as long as we can.
What are you running short on as far as PPEs for yourself to protect yourself? Because you guys, everybody's practicing social distancing. You can't, quite obviously. So what are you lacking right now that you're very concerned about just for your own safety?
So I was just told by my chief medical assistant that we are down to 2 N95 masks. And that is actually a very critically low number. It would be nice if we get more N95 masks. That would give the front team that's out there testing, more comfort. They are the ones right in the line of fire, basically, if I may say so, and doing these swabs and tests. So we would encourage if any construction companies in Arlington have unopened N95 boxes that they can donate us, we would really, really appreciate that.
I mean, paint shops use this as well. So what we really need is N95 masks. We need these face masks that we're using. I just got a donation from a very nice dentist because most of the dentist offices are closed. So they just cut off 100 masks. I'm wearing one of them right now. Gloves, gowns. So those, and face shields or eye shields. I mean, those are the minimum things we need. And obviously, as you know, supply chain has been hit hard in the United States. If we don't have that equipment, we can't really do much beyond that time. We may have the test, but we won't be able to collect it without this because we can't endanger the people that are working here either. So we're doing our best, but if your readers or anyone out there who has N95 masks, face masks, eye shields or gowns, maybe someone who's closed down their office while this is happening, if they can drop it off to our Arlington location, would be extremely helpful in the name of public health to save our people.
I understand that. What is your website? What is your phone number if they want to get in touch with you to deliver some of these much needed supplies?
Sure. Our phone number is 781-648-4572. And the website is afcurgentcarearlington.com.
All right. Thank you very much. And good luck. I hope some people can respond to your need, because if you guys get it, you're out at least for what, 2-3 weeks. So that takes one person out of the mix to give the test. Now, I'm hearing a lot of the symptoms are like a dry cough, fever, lethargy. But I'm also hearing that some of the symptoms could be lack of smell and lack of taste. Is that true? What symptoms are you seeing?
We are definitely seeing that in the folks that are triaging on our COVID triage, concerned about the symptoms. Some have mentioned lack of taste, lack of smell, but primarily the key ones that we've noticed are the dry cough, fever, lethargy, and breathing problems.
Now, this morning I was reading that in Wuhan, China, that they flattened the curve. They haven't had too many cases, but I understand on Tuesday, someone tested positive for the coronavirus in Wuhan after testing negative. So are you worried about a second wave here? Or I guess it all depends on how we behave.
Yeah. No, that's a very good question, Jeff. And the reason we worry about that is that we don't have a system like some of these Asian countries where they can put masses under curfew, for other words, right? There are still people walking around. There are still people not socially distancing themselves. We've seen that in the news media, people go to beaches and stuff. It's those people we worry about, right? Like me and you sit at home for 14 days. When we come out and we interact with those people, guess what? We can get the coronavirus again. So I think the whole idea behind quarantine, the ideal situation, the gold standard would be that everyone goes into quarantine at the same time. We sit it out for 4 weeks and then we come out, right? Now that's not happening. And I think that's what China is talking about, that they controlled it in the local population through these strict measures, but now they're getting this influx of people who are abroad, who are coming back home or back to the jobs or whatever, and they're bringing the coronavirus.
And we'd like to thank Urgent Care for granting us access to their facility. And at this time, we want to thank all the doctors, the nurses, and medical workers who are doing what they can. They are on the front lines each and every day, fighting an unseen enemy and doing what they can and putting their own lives on the line to keep us all safe. We certainly cannot thank you enough. Now, some Arlingtonians are doing what they can to have as much fun as they can during this crisis. And here's Nick Antonakis from what used to be Studio B, but I believe he's in his living room now, to tell us all about it.
How's it going, Arlington sports lovers, and welcome to another Living Room Update. I hope you're all staying safe and doing well. Athletic Director John Bowler has been staying active while practicing his social distancing. Bowler recreated Christian Laettner's famous shot for Duke from the 1992 Final Four from his backyard. So now, Arlington, show us what you can do. Recreate your favorite sports moment in history and send it to us at sports@acmi.tv to have a chance to be featured in our next newscast. Earlier this week, the board of directors at MIAA met to discuss the fate of the spring season. With Governor Baker's new date to reopen schools, the MIAA has made the decision to delay the start of the spring season until May 4th. They've also decided to extend the spring season to end June 27th. The MIAA will continue to discuss season logistics over conference calls as the situation develops. You can keep yourself updated at MIAA.net. To quench everyone's thirst for sports action, I'm glad to recommend this week's Spy Ponder Game of the Week. Every week, I'll recommend a fan-favorite Spy Ponder game from the past. This week's Spy Ponder Game of the Week is the 2019 Boys Varsity Soccer Squad's playoff matchup against the Belmont Marauders. Here's just a taste of the action to come.
There's sofa shift.
There's sofa shift.
Nice.
He sends it into Connolly.
There's Sean.
Connolly
lets it bounce.
And here come the Arlington boys. They should be coming up to help.
Connolly
with some time. He chips it into it.
That's Sheehan. Sheehan has some room. He gets by. He shoots. Saves it. The freshman Sheehan. Sheehan has tied the game.
Has tied the game.
The onion has been peeled. The onion has been peeled, and this thing's tied.
Was talking. Oh my goodness, because there's the freshman,
Aiden Sheehan.
You can find that game and more on ACMi Sports' YouTube page. Thanks for tuning in. From my living room to yours, I'm Nick Antonakis.
Thank you, Nick. As always, we certainly appreciate it. And we want to thank all those people who are keeping in touch with ACMi News so that we are able to keep in touch with you as we all try to wait out this crisis together. If you'd like to see all of our reports on the COVID-19 crisis, all you have to do is go to the ACMi website. That's acmi.tv. And you'll see all of our reports we've filed so far. Also, if you want some daily updates on what's going on with this crisis, you can go to the town website. That's at arlingtonma.gov. They're constantly updating that website as well. And we're keeping in touch, quite obviously, with town leaders. Also, if you have yet to file your taxes, the state income tax filing deadline for individuals has been pushed back now to July the 15th. So you've been given somewhat of a reprieve. If you'd like to learn more about it, all you have to do is call 617-887-6367. That'll do it for ACMi News tonight. We thank you so much for joining us. Please stay safe, and if you can, take care of others and watch out for them as well. Good night.
You can always check out our latest segments and newscasts on the web at acmi.tv/news. And don't forget to like us on Facebook and follow us on Twitter and Instagram at ACMi News. Make sure to subscribe to our YouTube channel as well. You'll find us at youtube.com/ACMi News. If you have any news tips for us or wish to become a citizen journalist, we'd love to hear from you. Email us at news@acmi.tv or stop by ACMI Studio A at 85 Park Avenue.